COVID cases surging once again and mask mandates back in effect at some New York hospitals.
This as millions of people are still dealing with long COVID or symptoms that continue well after a COVID infection, including shortness of breath, loss of smell, and brain fog. But now, thanks to a new grant, a team of Capital Region researchers are working to study and better understand long COVID in hopes of helping those still struggling. While the COVID-19 pandemic and the virus in general may seem like a thing of the past for many, it's never left the minds of millions of Americans who are still struggling with long COVID every day. According to the latest data from the CDC, in 2022, 6.9% of U.S. adults ever reported having long COVID. It's a far-reaching problem that Albany Medical College professor Dr. Ario Cedevich and his team of researchers are working to better identify and understand.
So we become involved in these studies because we were the doctors taking care of patients suffering from acute COVID. COVID was expected and was assumed to likely resolve after the vaccinations were scaled up. And we said, well, listen, it's going to be like influenza or other viral infections in which, sure, it's difficult, but you can get vaccinations and the situation gets resolved. And then we started to see about many patients coming to the clinic saying that they had protracted and lingering symptoms.
Those symptoms now identified as long COVID. The doctor and his team recently awarded a $3.9 million grant to study just that.
We haven't been able to identify a blood test that can specifically make the diagnosis of long COVID. We are conducting a study that is intended to identify a substance in the blood that is called biomarker or some kind of blood lab test that can define objectively that the patient has long COVID.
They're also working to develop a way to better monitor disease progress to more clearly identify if a patient is improving or getting worse. The study, still in its early stages, already recruiting hundreds of participants desperate to find relief.
We really want to be part of something that is bigger than themselves and trying to help others, and that is, a really inspiring thing to me.
Saying this work is just the first step in hopefully one day slowing the virus for good.
It's extraordinarily difficult to investigate this disease in a large scale, and without investigating the disease, it's very difficult to understand that and potentially to cure that.
The team is also partnering up with scientists at the University of Wisconsin on this research. For more information, or if you have long COVID and would like to participate in the study, visit this story at CBS6albany.com.